Good morning. This is Dr. McDaniel. It's Tuesday, May 7th, and I'm finishing up on the information I was presenting on urinary tract infections or UTIs. Sorry, I have bad allergies today, but it's common right now. It's spring, so I hope you'll bear with me. So as I mentioned previously and over the weekend, UTI stands for urinary tract infection. It's just a general term for an infection anywhere in the urinary tract system. So that's urethra, bladder, ureters, and kidney. All of the signs and symptoms associated with a UTI are predominantly due to a bladder infection, which is a cystitis. And the signs and symptoms can be a manifestation of anything that causes an inflammatory response or reaction in the bladder. The most common source for an inflammatory response reaction of the bladder is bacteria, which causes inflammation and predominantly spasming and uncontrolled or uncoordinated contractions or contractility of the bladder muscle. That leads to the myriad of symptoms I mentioned the other day. Those symptoms being most commonly waking up at night to urinate when you usually don't, or more often than you usually do, feeling like your bladder's full when it actually isn't, urinating more frequently, feeling like there's a pause or you have to wait for the urine to flow when you want to urinate, the feeling that your bladder never completely empties, you have to force the urine out, or it just stays a little bit of urine in the bladder, pain, pressure, discomfort, burning, any unusual sensation either during or as soon as you finish urinating, blood in the urine having a bad odor, back pain when you normally don't, or back pain more so or differently than you usually do, lower abdominal pressure, discomfort, pain, any unusual sensation even when you're not urinating, the urine being really dark, concentrated, more so than usual, nausea, vomiting, fever, chills. The fever chills are predominantly associated with a kidney infection or pyelonephritis. Nausea can be associated with the bladder, and vomiting also from constant pain, bloating, discomfort due to infection of the bladder. And all of those symptoms are predominantly going to be treated with antibiotics because we're going to kill off the bacteria that's the source of the bladder infection. Now, most people, if they know some of the signs or symptoms of a bladder infection or cystitis, they can clear that infection without taking antibiotics if they work diligently and if they work quickly. So at the very first onset of the signs or symptoms of a bladder infection or cystitis, they start drinking lots of fluids to really flush their system. When you flush your system, you're mechanically removing as much of the bacteria as possible. And what it allows you to do is it allows the bladder to rest, to decrease the constant inflammatory spasmodic contractions, so you'll have relief immediately, even before the bladder is completely rid of bacteria. Now, what I recommend people do is you should try to flush your system as quickly and as strongly and diligently as possible so that your urine is clear as water within 1 hour of waking up, and it stays clear throughout the day. So if you keep water on you, constantly sip every 2 minutes, every 5 minutes, just constantly sip water. You should try to maintain your urine being totally clear. Now, of course, the consequences of that will be initially that you're having painful urination frequently, or you frequently feel like you have to urinate. So that's going to be accomplished most often or most effectively by either staying home or somewhere where you're constantly near the restroom for the first 24 to 36 hours, and or by wearing an adult diaper, because the constant urge or discomfort is going to have some people bearing down a bit against their will and leaking urine. So it sounds silly, but it actually works. That being said, a lot of people will take cranberry juice, 100% cranberry juice, or cranberry tablets in an attempt to acidify the urine. This has mixed results, and it has a mixed, the jury's still a bit out on the effectiveness of this. There have been a lot of studies and scientific research looking to see if acidifying the urine actually works to help decrease or to prevent or to treat bladder infections. I think it does because bacteria likes an alkaline environment, so a high pH. If the urine is acidic, it does create a hostile environment for the bacteria, and it decreases the ability for the bacteria to multiply and to grow. So you're stunting its growth and you're washing it out. So those two together will work well. Cranberry tablets or cranberry juice works very well, but that can also be accomplished with grapefruit juice. So a lot of people will take grapefruit juice instead of cranberry juice if they don't like the cranberry juice. D-mannose is another supplement that can be obtained at a homeopathic or a health food store. A lot of people will take D-mannose, and it's just an attempt to really dilute or to flush. So it's a diuretic to flush the system as much as possible so that you can eliminate the bacterial concentration that's trying to build up. Now the catch is these will only work if you keep the system as flushed as possible, minimize the ability for the bacteria to grow, and if you persist past feeling better. Most people will be able to feel better to flush their system, they feel back to normal, but then once they stop flushing their system well, the bacteria grows back again because it's not completely annihilated, and then they have their symptoms within 3 to 4 days. They're right back where they started. So if you do the homeopathic treatment, you don't want to take antibiotics, you have to continue flushing your system for at least 5 days, 5 long days after you feel better. So you want to keep your urine as clear as water at least 5 full days after you feel back to normal. That will completely flush the bacteria as well as possible. And you want to keep acidifying the urine for the 5 full days after you feel better. Now, if you go the antibiotic route, the most common antibiotics are nitrofurantoin or macrodantin, trimethoprim, sulfamethoxazole or Bactrim, Augmentin, which is amoxicillin clavulanic acid. Those are the 3 top antibiotics that will clear the majority of bladder infections. But as I stated previously, if you go to an urgent care, your primary care doctor or your gynecologist, your PCP or general doctor to be treated, you should have a urine culture obtained so that you can confirm that the symptoms we're assuming are due to an infection of the urinary tract system really are due to an infection and not due to another inflammatory source that's giving the same symptoms. And the cultures are supposed to be sent for chlamydia, gonorrhea if anyone is sexually active, married or not married. We don't take that into account in medicine to confirm that the symptoms aren't due to a sexual infection, because those 2 infections, chlamydia and gonorrhea, can be the source of a UTI, a cystitis, a bladder infection for some people. Now, if you want to try and prevent an infection, you've had some in the past, you know you're prone, you can prevent a bladder infection, but you have to just basically stay well hydrated. Don't hold your urine. Urinate when you feel like you have to go so that you don't have stagnant urine sitting in the bladder. After any activity that increases friction, so intercourse is the most common, but after that it's going to be exercise, especially bicycling or stationary cycle. And then it's also going to be swimming. If you wear thong underwear or tight jeans, any type of tight clothing or layers, or if you've had a day out where you haven't drank much fluids, you were dehydrated that day, you want to try and overcompensate by really flushing your system. Those are the usual go-tos that will work. A lot of people will also try to keep their urine acidic or acidify their urine with cranberry tablets or grapefruit juice in order to maintain a somewhat hostile environment for their bladder to prevent bacterial buildup. That's an option. I would say it's probably not good to do that on a constant basis, but to do it periodically after an activity or an event, or if you've been dehydrated or you've been holding your urine for the previous day or earlier that day. It's good to try to max out flushing it and then to acidify the urine. So I hope that's been a helpful presentation on urinary tract infections, UTIs. I think this is the last, so that's pretty much a wrap up on that. And tomorrow, Wednesday the 8th, I'll come back with a different subject, a different topic for presentation. If you have questions or if you have suggestions for topics, please feel free to send me a message either here on Facebook or on my YouTube page. It's GYN Corner. Thank you very much for watching, and have a good rest of the day. Bye.